Thank you, and it's amazing how time flies when we're having fun. And it's hard to believe this is the third round of presentations of the Safe and Sound Award. This is NIOSH and NHCA have collaborated in many different initiatives. This is certainly one of the most fruitful and comprehensive. And even though this is the third round of presentations, the work started before that. So we are this year celebrating the 5th year of this joint collaboration of NIOSH and NHCA and other partners in the award expert committee. This committee have been working together for this 5 years, coordinated by Diana Maiki, and they have been really superb in helping create award nominations criteria, nominations form, evaluation criteria, and so forth. I've learned and enjoyed this process truly, and I would like to express my sincere appreciation for each of the members of this committee. And also to all NHCA members, some of our best nominations came from this group of people who know of success stories of people who are doing superb jobs in either controlling noise or preventing hearing loss. So I ask you to keep up the good work, keep sending us, and encourage these success stories to submit nominations for the Safe and Sound Award. We do need this help. Our objectives in this collaboration are not only to recognize innovation and organizations that document measurable achievements in hearing loss prevention, but also to share their strategies and leading-edge information widely. And we are working together to develop a series of communication products. Also, the presentations that happen at NHCA are posted on our website. They are the basis of these communication products. And for the I know that the NIOSH director tried on previous occasions to join us in presenting an award, and it was not possible. And this year we are lucky to have Dr. John Howard, the NIOSH director, to be here to present the 2011 Safe and Sound Awards in the manufacturing sector and in the service sector. Thank you.
Thank you very much. It's a pleasure to be here. Thank you for inviting me. Before I begin, I want to thank each and every one of you for the work that you do to protect America's workers, civilian and armed forces throughout the world. The National Institute for Occupational Safety and Health and the National Hearing Conservation Association are pleased to jointly announce the recipients of the 2011 Safe and Sound Excellence in Hearing Loss Prevention Awards, honoring those who have shown their dedication to the prevention of noise-induced hearing loss through innovative practices, policies, and unique advances in your field. I want to thank, as Thais mentioned, the awards committee for their work in selecting these candidates. Noise-induced hearing loss, as we all know, can affect workers in every sector of the American industrial enterprise. And this year's winners show us the power of teamwork, ingenuity, in developing innovative solutions to protect workers, not only in the home front, but also in the front lines of the workplace. So I'm very pleased to recognize this year's award winners. I invite them to present a short presentation of their Safe and Sound nomination. The first award winner is Shaw Industries Group. It's the world's largest carpet manufacturer and leading floor covering provider. The plant WM Division Fibers in Georgia is responsible for producing the yarn needed for carpet manufacturing, an inherently noisy process. The Division Fibers is being recognized for the demonstrated results in noise control and hearing loss prevention, and their continuous efforts to improve the quality of implementation of several of their hearing loss prevention program components. These include noise measurements, engineering and administrative noise control initiatives, provision of a wider selection of hearing protection devices, fit testing verification of the attenuation provided by those devices, audiometric testing, training and program evaluation, and facilitating the adoption of their strategies by other Shaw facilities. It is a great pleasure to invite Kenny Dillard, Safety and Health Training Manager of Shaw Industries, to present their accomplishments and to receive a Safe and Sound Excellence in Hearing Loss Prevention Award. Mr. Dillard.
Good evening. As he mentioned, I work for Shaw Industries, Plant WM in Dalton, Georgia. We are a yarn producing manufacturing facility. Plant WM is one of 7 within our division. We are a subsidiary of Berkshire Hathaway with roughly 25,000 employees across the United States. And at my particular location, we have about 335 associates, about 250 of which fall into our hearing conservation program. If you were to come to Plant WM, one of the first things you would notice is very loud. Okay, it takes a lot of air to process yarn. So, you know, as it was becoming a major problem for us, you know, we had to start thinking through our hierarchy of controls and what can we do to eliminate exposure and protect our employees. So the first thing we looked at was our engineering control, and we said, what can we do to prevent exposure? And if you look at the picture on the left, that is some filtaco equipment. It's Italian extrusion equipment that we use in our plant. And the first picture on the left shows what a winder panel looks like with our prototype box, the black box. And then the picture on the right is going to show after we installed these boxes throughout the entire line. Now, each one of these boxes were about $4,200 a piece, and they had to be custom made for each position. If you can see the yarn running overhead, they come in at different angles. So it took quite a while to actually design the box and get these boxes installed. To outfit one of these lines was, you know, roughly about $45,000 a piece, I believe, of which we outfitted 4 machines with these particular boxes. And here are the results. You can see pre-enclosure and after enclosure. Again, we had some very high noise levels at our facility. But after we implemented these and put these boxes in place, you can see on the far left-hand side, really that indicates the location on the machine. So we see F16-2, that was position 2, which is closer to most of the noise source, on out of the pack-out table, which is relatively, you know, 15 to 20 feet away from the noise source. So, you can see that we saw, you know, roughly 7 to almost 10 decibels reduction. So very significant. As far as administration, it was about 1.5 years ago, I guess, I got an invite to go to a luncheon to see a demonstration of the VeriPro machine. I can remember walking in and seeing this device and was just completely blown away. You know, I've been in environmental health and safety for about 15 years, and it was the first product that I had seen that really changed my whole paradigm. You know, it changed my whole thought about what we can do for our associates. You know, for years our policy was, you know, we provided in our 33 plugs. We had 3 different choices, and we trained our folks every year. But in the back of my mind, you know, I was always, you know, is that enough? You know, are we really getting the protection that we need? You know, we had no way of knowing. But with VeriPro, you know, now we have a tool that can tell us precisely what protection an associate is getting. So it was very exciting, you know. So when we got this machine, I can remember I went back, met with my HR manager, and I told him, I said, hey, I've seen a demonstration of this machine, we've got to have this. So we go to the plant manager, he said, you know, if you think it's something that can help us, you can get it. So within, you know, a couple of months, we got it in place. We ramped up from 3 devices up to 6, and then we started testing. And, you know, what we try to do is we go through a certification process. You know, each person comes in, we sit down with each person, you know, ask them what plug do you want to try to get certified to, and we work through. You know, we test them. If it works for them, for their environment, you know, they're certified to that plug, and that becomes their plug. If not, then we go on to the next one. You know, we've had some fit testing sessions that last, 20, 25 minutes, and we've had some that have lasted up to an hour and a half. You know, it's how long do we need to get the right person in the right plug. So that's what it's all about. And this just goes to show, before testing, the dark blue is the initial test. You can see we're all over the place. And then final results, you can see that we've protected our associates down to 85 and 80. So remarkable improvement again. Again, we expanded our HPD offerings from 3 to 6, and actually I plan to go back. I've got some good literature while I've been here today and looked at a lot of new products, and hope to go back and even expand that to probably 9 to 12. Associates are certified to a single hearing protection device, as I mentioned a minute ago. And then ongoing fit test verification will be a part of our audiometric test. The nurse, she'll do the audiometric test, come out, do the fit test training with them, and then she'll do a quick check in the VeriPro just to verify that they're still getting the attenuation that they need. We've also identified less noisy areas in the facility, in the department, and we encourage our employees, when not engaged in the machinery, go to these quieter locations. We instituted in-house audiometric testing for years. We had the van that came by and did that test for us. Last year, we procured a booth, put it in place, and now we do all of our testing in-house. We've also mandated job rotation in these departments. One thing you'll notice if you walk around with a meter, you can see it's a lot louder in some places than others. So we encourage our folks, you work 3 hours here, 3 hours here, 3 hours here. We don't want you positioned in the same spot, giving maximum exposure for the full shift. And then we strongly encourage our employees to submit work orders for defective equipment. It doesn't take much. Small crack, magnets get bad, you get air leaks, and it ramps up your noise level. So we strongly encourage our employees to take care of their equipment. And the efforts have resulted in lower noise exposures as well as increased assurances of hearing protector effectiveness and focus on hearing conservation by all associates. Our folks know that their hearing is very important. What I like to tell folks, if you don't wear your hearing protection correctly, I'm not going to lose my hearing. It's very personal. It's you. You want to be assured that when you get older and you're with your kids or grandkids that you can hear. It should be very important to you. And really your neighbor. You should be very concerned about your neighbor here. So if you see that where they're not wearing their hearing protection device correctly, you need to say something. It needs to be a part of what you do. We have seen a significant reduction in the number of STS cases. For years we just kind of had the mindset that it was a part of it. It was a part of what we did. Again, we had high noise levels. And what we try to do as well is anything that we develop in-house, initiatives that we come across, we try to share that with our other Shaw brethren around the company. If they come across something that works well for them, they share with us, we'll try it and see what happens. And this here, just to go back and show you our confirmed STSs back in 2006. We recorded 5 that year. Years prior to 2006, probably very similar to that. And since then, since we've started integrating a lot of our engineering and administrative controls, you can see that we've seen a significant reduction in STSs. Now, what will this award do for us? If I had to sum it up in one word, I would say it would be credibility. So when I go to my management staff and say, we would like money to implement more engineering controls or administrative controls or PPE controls, I think that we've earned some credibility to go to management and ask for the resources. So. And again, my name is Ken Dillard. Tom Hunterbreaker here, who's in the photo with me, is our company industrial hygienist. Joel Korn, the developer, one of the guys I work with, developed the boxes that we use in our field takeover department. He's since moved on to bigger and better things, so he's not with us here today. And then we have Tim Bates, my human resources manager. He came with us because really without Tim's efforts, again, he was the guy that I went back to and said, hey, we need this. And he said, let's make it happen. Can't ask for much more.
largest U.S. Army bases. Clearly, as we are a nation engaged in warfighting, over 26,000 Army, National Guard, and Reserve soldiers were activated and demobilized from their deployments throughout the United States, Europe, and the Middle East via Fort Carson in just 2010. The noise levels of warfighting are extreme and inherently challenging to manage in terms of hearing loss prevention. Beginning in 2007, a pilot program was implemented at Fort Carson designed to recognize the critical value of functional hearing loss for warfighters, for their readiness, and for effectiveness and safety. Captain Leanne Cleveland and the Fort Carson Army Hearing Program in Colorado Springs, Colorado, are being recognized for their innovative efforts to implement far-reaching programmatic changes outlined in Army Hearing Program. The elements of this program include timely hearing testing, multi-level educational programs, hearing program officer integration, expanded hearing protection options, appropriate amplification matched to a soldier's work-related hearing demands, and a commitment to each individual at risk of noise-induced hearing loss. Their organizational teamwork and flexibility is especially noteworthy in this high-volume, time-critical work environment. The Fort Carson Hearing Program has had a direct impact on the hearing status of individual soldiers and their ability to continue to perform their military duties. The pilot program outcomes have had significant implications for system-wide advances in both civilian and military hearing loss prevention programs. It's an honor to invite Captain Cleveland to present the accomplishments of the program and to receive a Safe and Sound Award for innovation in hearing loss prevention. Captain.
My name is Captain Leanne Cleveland, and I am an American soldier.
What?
I'm also an audiologist, and I'm the manager of the Army Hearing Program at Fort Carson. I'm supported by one of the best audiologists I've ever known, Captain Jenny Davis. Please stand up. We are part of the Preventive Medicine Department at Evans Army Community Hospital, which is part of Fort Carson, Colorado, home to 26,000 soldiers who are assigned to the 4th Infantry Division. The 4th Infantry Division has owned the war in Iraq since it began. So we have our soldiers, if you're not in Iraq or Afghanistan, you're getting ready to go to Iraq or Afghanistan. We're also a power projection platform, which means we have several thousand extra National Guard and Reserve soldiers pass through our post every year, being activated to deploy to US, Europe, or Iraq or Afghanistan. Captain Davis and I have a team of 6 civilian audiometric technicians, and they are very dedicated and loyal. And our team works as part of an interdisciplinary team with other people. We have occupational health, physician assistant, 5 nurses. We have 3 industrial hygienists and 1 industrial hygiene technician, and an environmental services officer, a sanitarian, and 3 active duty environmental services soldiers as well. In 2007, we were designated as a pilot test site from Mr. Thresher, who's the Chief of Staff of Army Medical Command. And the impetus for the pilot was really based on the fantastic work done by Major Mathis at Fort Stewart and her groundbreaking work in operational hearing services. And I do appreciate your mentorship as well for all of this. So I was tasked as the manager of the pilot test site to not only integrate the 4 elements of the Army Hearing Program, but also to develop metrics to measure the progress in each of the 4 elements, and then supply the data back to the command. So the 4 elements of the Army hearing program are hearing readiness, clinical hearing services, operational hearing services, and of course hearing conservation. Hearing readiness, this is basically the mission that we have at our soldier readiness processing centers. And it's asking 2 things. Does the soldier have enough hearing to perform in his or her military occupation? And do they have the right hearing protection to perform in his or her military occupation? So the ways we accomplish this is every soldier is required to have a pre-deployment hearing test and a post-deployment hearing test. If you're in processing to Fort Carson, you get an in-processing hearing test. If you're leaving to another post or you're exiting from the Army, you get an out-processing hearing test. And if you're just hanging around doing nothing, you get an annual hearing test. So everybody on our post gets at least 1 hearing test a year. And before the pilot started, it was just that, the hearing test. But now it's an otoscopic examination, and everyone is fitted with a linear and a non-linear form of hearing protection prior to the hearing test. And this is the mission of our 6 technicians. So again, in 2009, our 6 civilian technicians tested over 45,000 soldiers and civilians coming through our Soldier Readiness Processing Center. That's 90,000 years when you think about it. And actually, just a couple months ago, we had a case where one of the technicians found a glomus tumor in a soldier who was about to deploy to Afghanistan for a year. And that was just because of the otoscopic examination. We had done a little bit of a professional development, and we're talking about just some of the funky things in audiology. And as she was looking in his ear to fit him with earplugs, she noticed this very bright red eardrum. She talked to the lead technician. He said, "Wow, that's a really funky eardrum." They consulted me. I said, "Yes, that is a funky eardrum." We ordered the MRI, and sure enough, it was a 4 centimeter at its widest point glomus tumor. He did pass his hearing test, so if we had only done the hearing test, he would have been sent to Afghanistan and likely would have died because it was huge. And that's just a testament to the great process that we have. So for hearing readiness, the metric that we use is the medical protection system data. Basically, if you're a Category 1 or Category 2, it means you've had that annual hearing test and you followed up with me or Captain Davis if we found something funky. If you're a Category 3 or 4, it means you either have not had that annual hearing test or you have not followed up as you were supposed to. When we started the pilot in 2007, we were at a 74% for Category 1 or 2, or go, fully ready to deploy. And currently we're at a 96% go rate for hearing readiness at Fort Carson. So clinical hearing services is the next element of the Army hearing program. And this is when the patients come to us for a full diagnostic evaluation. So it's your diagnostic audiometry, ABR, hearing aid fitting, or TCAP dispensing. And then I also have an interest in central auditory processing disorders. In addition to Captain Davis and I, we do have 2 civilian audiologists who work in the ENT clinic under Department of Surgery. Their mission is to care for the family members of the soldiers. So basically, if you're a civilian, you see the civilian. If you're in the uniform, you see one of the uniformed audiologists. But we do, during the high op-tempo times, our civilians act as a pressure valve and kind of see some of our referrals when we're not able to, and vice versa. Because I do a lot of central auditory processing, I sometimes see their patients as well. So again, it's a good arrangement. Operational hearing services, this is, as I said, the real bread and butter of the Army hearing program. Captain Davis and I have the luxury of only spending 50% of our time in the clinic. The rest of the time we are out there, like Dr. Blesser said, entrenching ourselves with the units, going to the range. We don't call it a range inspection, we call it a site assistant visit. We bring extra earplugs with us, we talk to them about their hearing protection, we let them try different stuff. And usually at the end they say, "Hey ma'am, have you ever fired a grenade launcher? You want to give it a go?" And it's pretty fun. We get to shoot some fun stuff. And You know, but again, you're not going to be taken seriously if you come in there with I'm the inspector with my pen and clipboard. You really need to remember that you're a soldier first, and that's been really what's made us successful. The other thing is we've managed to get our 2-star general to sign a standard operating procedure, which dictates every unit will assign a hearing program officer for their particular company. The person who's chosen is required to attend a 3-hour education briefing, and we describe, again, otoscopy, earplug fitting, anatomy and physiology 101, impulse noise, steady state noise, different types of hearing protection, and then they're required to pass a written and practical examination. The practical examination is they look in my ears and fit earplugs. Mm-hmm. And once they graduate from that, then we keep them supplied with all the earplugs they need. They come in and get all their tackle boxes filled up with the appropriate hearing protection. And we also let them know that they are in charge of organizing annual hearing health brief. So again, we're giving them the tools to take that out to their troops and educate them, or we offer to come along and do the briefing as well if they're uncomfortable. And then we also ask to be invited to inspect one of their noise hazardous areas, usually the rifle ranges, but sometimes we get into the motor pools and stuff like that. Hearing conservation is the 4th element, and again, this is based on the model we all know and love, which is designed for noise-exposed civilians. We do have 400 noise-exposed civilians on Fort Carson, primarily the people who are running the ranges at range control, and also our security gate guards. So really the big programmatic changes that we've implemented is not just processing the soldiers through getting that annual hearing test, but looking at the soldier as an individual and giving them the tools to prevent hearing loss in themselves and empowering them to become their own hearing program officer, and I won't use the word hearing conservation officer, through the multi-level educational programs. Again, we've got a great team working between the Soldier Readiness Processing Center, Department of Employment and Health, Preventive Medicine, Department of Surgery. It's a good team. The hearing protection devices, of course, we've increased the amount that are, the type and the amount that are distributed to the troops. And like I said, everyone gets a linear and a non-linear hearing protection. If you've got super tiny ear canals, then we do a custom ear mold for you. Again, we give you a linear and a non-linear. If you have a hearing loss, then we order one of the T-caps for you as well. And again, we really look at the soldier as an individual and how can they accomplish their mission. Lessons learned, you know, war is unpredictable. And in certain circumstances, even when you've got the right hearing protection, you're using it correctly and consistently, it might not be enough in the event of IED, EFP, that sort of thing. But again, in battle, I get it, but in training, it's always preventable. And I have pretty much a zero tolerance for training. They call them training accidents. We're trying to get that changed to training negligence, because like it is, you might want to hear that 50 cal just because you want to know what it sounds like going off without hearing protection, but that's just stupid. It's not an accident, it's negligence. And again, you know, Jenny and I have gotten out there. We've sat in the Apache helicopter and let the guys show us all their bells and whistles in the helicopter. I fired that grenade launcher. You got to get out there and be one of them, not the subject matter expert in the white coat. You got to be a soldier first, and that's been crucial for our success. Is the interdisciplinary team looking at the individual soldier and also taking on their perspective. The future of the innovation, again, I think there's no reason why the 4 elements of the Army hearing program couldn't be adapted to a civilian industry. I took a tour of the Toyota plant, and they have all these little teams Why couldn't you have a team leader, your hearing program officer, and give them the tools and make them responsible for their particular group? Again, we want to use the data that we have, and the only reason why I haven't showed you the data from the clinical hearing services, operational hearing services, and hearing conservation is because it is considered sensitive, and I'm not allowed to share it, but it was part of the submission for the award. The numbers look better than they did in 2007, I should say that. And then we want to just keep exploring alternatives. Every year, the weapons are getting bigger and louder, so the hearing protection has to evolve along with the weapon systems. And again, Mr. Dillard said, you didn't say leverage, you had a better word.
Credibility.
Credibility, I like that. So I'm changing this. I think, again, credibility. We're not just the ladies who dispense hearing aids and do the hearing tests. We're soldiers, and we're out there and we're preventing hearing loss. And we're going to advocate as well for more and better tactical communication hearing protection systems, because so many soldiers have gone through multiple deployments and have hearing loss. So, and again, promoting accountability on all levels. No longer calling it a training accident if it happens on the range, but training negligence and holding people accountable for that. This is our team. We have Mr. Ron Magalong and Janine Gonzalez. There are 2 technicians in preventive medicine, Captain Davis, Melissa, Emmanuel, Zeddy, and Charlene are our technicians. Remember, these 6 technicians tested 45,000 people in 2009. Brenda is our one and only scheduling clerk. God bless her. And that's me. I do need to also thank my husband, Major Richard Cleveland, retired, 22 years and 4 combat tours. I also want to thank our children, Miriam and Joshua. You two are the reason why your dad and I work so hard to make the world a better place.
Thank you very much, and I want to thank the NCHA for their partnership in this project and for hosting the award ceremony. Congratulations to Shaw and to the Army. We're now adjourned. Thank you very much.